This is Dr. Katie Mordino from Rutgers Executive Education, and I'm speaking with Lan Nguyen, who's a System Process Improvement Engineer at Mainline Health System. Lan, once you had your Black Belt certification, what happened when you started to apply those concepts at work? What were you able to accomplish there?
Thank you for your question. After I obtained a successful in my Black Belt project, I moved on my position from campus to System Process Improvement Engineer to work on more complex and bigger scope projects. So I just want to highlight some my recent accomplishment in mainline healthcare. So I lead a team OR efficiency to improve first K on-time starts for four acute hospitals in the system. Before I started the project, the percentage first K on-time start is 65%, and working together, understanding the root causes of the delays, we improved from 65% to 87% for four acute hospital of mainline health. Another project I want to share, we designed the patient flow in emergency department to reduce the wait time for the physician from 30 minutes to 45 minutes and reduce the percentage of leave without treatment from 2.5% to 0.8% last year. The last one I want to share is reduce the average length of stay for just 10 patients with average length of stay from 37 hours to less than 24 hours. So with the accomplishment, I move on to more complex projects in the system.
Those sound like amazing accomplishments. It's really great to hear about them. Have you had other opportunities to apply what you've learned in the program?
With these projects, I applied Lean tools with using the DMAIC framework to define, analyze, measure, and redesign the process to improve to improve the process by reducing on the waste, eliminate on the non-value added to the process, and we work together how to sustain the improvement. So I use a lot of Lean tools in data analysis, understand the root causes, using Lean tools, Fishbone, SciPark, to really know where's the root cause of the issue. And from that, we propose the solution to solve these issues.
It sounds like you must have worked with the other people who are in those areas as well. Did you help them understand what the process was?
Yes. So my team have limited understanding what Lean Six Sigma about. And from working with me in this project, I help them to have good knowledge about what Lean about and how to use to solve the problem systematic way, to work together to find the solutions, not only to improve the process, but bring the better care to our patients.
That's a wonderful focus to have. I think you mentioned when we were talking about doing some green belt training. Can you tell us what you've done with that?
So I expand my scope as a Vietnamese native immigrant to U.S. So after my Black Belt certification, I had opportunity to went to visit Vietnam to train green belt in hospitals in the south of Vietnam. So in last 2 times, I trained more than 200 green belts in hospitals in Vietnam from about 15 hospitals, and all my students are doctors and nurses, physical therapists, and lab technician. Because Lean Six Sigma is still very new to Vietnam market, and to bring a really new knowledge, and I already successful in using Lean tools, it's very good. So that I transfer that to my students, and as a native speaker, I can, translate English to Vietnamese and share my operations, how to improve their working style, to eliminate waste, and to bring better care to the Vietnamese patients in Vietnam. And with on that work, I got recognition from Merck pharmaceutical company in Vietnam to sponsor for our training.
That's a wonderful way to spread that knowledge and information. Thanks for sharing that with us.